Advanced Diploma Cardiovascular Healthcare in Nursing 2022 presents Angiogram. Angiogram was invented in 1927. A coronary angiogram is a procedure that uses X-ray imaging to see the coronary artery. It's a routine procedure that involves a team of cardiologists, nurses, assistant medical officer, and a radiographer. Now, let's revise the angiogram procedure flow in this 5 stages. Here is a breakdown. The patient is first escorted from their ward or daycare unit to the lock room. During this handover process, the nurse performs a compulsory criteria check to ensure patient safety, following the guidelines of the Malaysian Patient Safety Goal: safe surgery saves lives. After the handover, the patient is assigned to the recovery bay, where they will wait before the procedure begins. Vital signs of the patient, such as blood pressure, heart rate, and oxygen saturation, are recorded and entered into the system for monitoring during the procedure. The patient is transferred to the angiogram suite, which is equipped with the necessary imaging equipment for the procedure. This is where the angiogram will be performed. Throughout the procedure, the cardiologists performing the angiogram are assisted by scrub nurses. These nurses provide support, hand them instruments, and help maintain a sterile environment. An assistant medical officer, stationed in the technician room, records all the details and events that occurred during the angiogram procedure. This documentation is essential for the patient's medical record and future reference. Before performing any interventions, the cardiologists review the diagnostic images provided by the radiographer. These images give them a clear understanding of the patient's heart blood vessels and guide their decision-making during the procedure. After the angiogram is completed, the patient is placed back in the recovery bay for monitoring. This allows healthcare professionals to observe the patient's condition and ensure their stability before transferring them back to their respective department, such as the ward or daycare unit. Next, medication. These are the medications that are commonly used in the angiogram procedure, which is prepared priorly. IV heparin 5,000 unit in 5 milliliters. Withdraw 4 milliliters from it and dilute with 16 milliliters normal saline. Total would be 20,000 unit in 20 milliliters. The dosage would be 1 milliliter equals 1,000 unit. IV glyceryl trinitrate 10 milligrams in 10 milliliters. Withdraw 2 milliliters from it and dilute with 8 milliliters normal saline. Total would be 10 milligrams in 10 milliliters. The dosage would be 1 milliliter equals 1 milligram. IV adrenaline 1 milligram. Withdraw all of it and dilute in 9 milliliters normal saline. Total would be 1 milligram in 10 milliliters. The dosage would be 1 milliliter equals 100 micrograms. IV atropine does not need to be diluted, prepared in the syringe as it is, or as we usually call it, pure. There are some other medications that might be needed in angiogram. Refer to your facility protocol if you need it. Next, the sets for the procedure. For the angiogram tray layout, we usually will use 2 sets of equipment, which is 1. Cardiac catheterization set. 2. Skin preparation set. The layout will be arranged conventionally. 1. The equipment tray. Here we will put 2 pints of normal saline plus 1 milliliter of IV heparin 5,000 unit per mil. This tray is for you to put all the used wires or catheter in the procedure. 2. The injection tray. This is usually where you put all items such as radial or femoral sheath, IV lignocaine, IV heparin, and blade. 3. Skin prep tray. This is for you to set up a skin preparation such as gauze and chlorhexidine. Once used, this will be discarded from the layout since it is considered dirty. 4. Flushing bowl. Here we put 1 pint normal saline plus 0.5 milliliters of IV heparin 5,000 unit per mil solely for flushing. 5. Receiver bowl. We will discard any dirty gauze or blood clot here, but before that we can use it to put manifold so that we will easily assemble it with the AO pressure and also contrast. 6. Extra bowl. Here you can put your needle or unnecessary things, but this bowl is required when intervention is needed, such as PCI. PCI tray. This is the example for a PCI tray when needed. You might need to prepare another set of trolleys and basins protocols. This is the patient's education that you will explain after the procedure is done. That's it for now. There's more to learn, but let's leave that to you to experience in the latter. We hope this video benefits you in this course. Good luck!